So subtle differences. So RSV typically affects young children, although we are seeing adults now with RSV, and even some adults are getting hospitalized with RSV. So RSV is typically a cold type virus. So runny nose, stuffy nose, wet cough. That's very common, sometimes a low grade fever. But in the babies, and now again, older children and adults, it can start causing breathing problems. So wheezing, difficulty breathing, deep cough, something called retractions, where they're using their extra muscles to breathe. So respiratory distress, turning blue. So those are all extreme cases of RSV. But RSV typically is just like a cold virus and presents very similarly to any sort of winter cold that we've had years and years. Flu or influenza tends to hit hard and fast. So this is the time where people typically would describe themselves as feeling like they're getting hit by a truck.
Hmm.
So they have a high fever, body aches, they can't get out of bed, just feeling terrible. They can also have the associated sore throat, stuffy nose, but it's really just an overall feeling awful. And COVID, as we know, over all these 2.5, almost 3 years that we've had it, can be a million different things. Fever, sore throat, loss of sense of smell, body aches, feeling terrible. There's the gamut of symptoms with COVID-19, but a lot of them do overlap with RSV and flu.
Out of the three that we're seeing this season, which one is the worst?
Worse is a tricky term. So, I still, COVID is the worst in many ways because of long COVID. I think that's really, really still concerning. COVID is still killing 300 people a day in this country. So, in that way, COVID is still a number one concern. The worst right now is RSV is filling hospitals, and it's filling pediatric hospitals where states such as Colorado have barely any pediatric ICU beds in the entire state. And with that, it's not only that the hospitals are filled with sick babies, that means that children who need what we would call elective or non emergency procedures can't have them done. So many hospitals have started canceling surgeries, canceling elective admissions, canceling non urgent procedures, delaying care because there are no beds in hospitals. So that's really an overall healthcare, widespread health system concern. I think number one right now is RSV. Flu is very dangerous. In years past, we would see 20 to 50,000 deaths per year in this country alone from influenza complications. So that's still a very serious virus. The thing about flu is that we do have a vaccine to prevent getting sick and prevent serious complications. As we know, no vaccine is perfect. The influenza vaccine, some years it's great, some years it's not so great. We don't usually know until the following year how effective the vaccine is going to be. But flu is, does have that layer of protection as opposed to RSV, which does not.